A rise in respiratory virus cases across the country has hospitals in some states bringing back mask mandates. The CDC says more than 29,000 people across the country were admitted to hospitals with COVID between December 17th and the 23rd. There were also nearly 15,000 people in the hospital with the flu in that same period. All of this now has New York, California, Illinois, and Massachusetts reinstating mask mandates in hospitals. Let's bring in Dr. Matthew Sims, Director of Infectious Disease Research at Corewell Health. Dr. Sims, thanks for joining us today.
Happy to be here.
So the words mask mandate might send some goosebumps across a few arms. People are nervous about this. What is your reaction when you're hearing that cases are going up and those masks are going back on?
Yeah, so masks have been something we've used to protect ourselves from respiratory viruses for years, even before COVID. But once COVID hit, they really became an important part of protecting everybody. You have to remember there's a difference between a mask mandate in a hospital and a mask mandate for the entire population. In a hospital, that's where we deal with the sickest people. We have a large number of immunosuppressed people, and it's really important to prevent the spread of respiratory viruses, especially COVID, flu, RSV, in the hospital. So when it's really at a high level, when you really have a large number of patients admitted with COVID, it's very important to do everything you can to prevent the virus from going from one patient to a nurse or a doctor or somebody delivering a food tray to another patient, or from a family of a patient to another patient or to the hospital staff. All of these things are there to protect the most vulnerable patients.
Yeah, so here in Michigan, our COVID numbers, they're up there. We're not the worst in the country, but not the best either. So why aren't we seeing this here yet?
Yeah, so believe it or not, we're still, if you look at a map of COVID in green, yellow, red, we're still in the yellow here in Michigan. We're not as high up as some other states. But some hospitals are probably getting more than others. And I think each hospital is going to have to look at their population and how much COVID they're getting. Our numbers at Corewell are up across the board, across all three regions of Corewell Health. And that goes for COVID and flu and RSV. But we're still below, for each one of those, we're still below 10% of the bed capacity being for those viruses. If you put them all together, we're just over 10%. And if that number keeps going up, we may have to do something to make sure that it's not spreading within the hospital as well.
Is this something we should just get used to at this point, especially this time of year, respiratory virus season? It's very cold and dry out. Is this just something we're going to go through in waves going forward?
Yeah, well, remember, flu and RSV, they're up this time of the year no matter what. There are other viruses that are up this time of the year. But COVID is a year-round virus, but it does seem to go up around this time of the year. Part of that may be the cold, dry air, as you said, which we know helps flu and other viruses spread more easily. Part of that may be just people getting together for the holidays and thus infecting each other. All of these things all go together. I do expect that the COVID numbers will continue to be in waves. I do expect that around the holidays, they'll probably go up.
From your vantage point, what is the general consensus? Because there are some places, plenty of places, you do see people voluntarily just wearing a mask, presumably to protect themselves or others. Do you think that we've come a far way from that time when it was a very, very contentious issue?
There are people out there who just will never wear a mask, no matter what, they just don't want to do it. And there are people out there who will wear a mask all the time. I still wear a mask routinely. Certainly in the hospital, I'm always wearing a mask. And that's both to protect myself and to protect my patients and the people I work with. But I wear a mask when I go to the supermarket, when I go out, if I go to a movie, I'm wearing a mask. If I'm on a plane, I'm wearing a mask. And there's, the reasons I do that is, honestly, I don't want to get COVID. I still have not yet gotten COVID, and I'm hoping to keep that going. I don't want to take the risk of getting a serious infection. I don't want to take a risk of long COVID. But at this time of the year, it's also, I've gotten my flu shot, but, it doesn't protect you 100%. It does protect you against the severe consequences of the flu most of the time. But I don't want to take a chance of getting the flu anyway. I don't want to get RSV or any of the other viruses that are circulating right now. So, I choose to wear a mask. I'm not going to yell at people around me to wear a mask when, there's no requirement to do so. But I'm going to protect myself and the people around me. That's my choice. It's their choice to not wear a mask right now. But in the hospital, the hospital is just a different place, right? Like I said, that's where the sickest people are. We have people who are on chemotherapy. We have people who are on other immunosuppressants. We have people who are, barely being kept off ventilators. Um, and COVID can really just do those people in. And we sometimes just need to do what we have to do to prevent our patients from being at risk.
Yeah. You still haven't had COVID. That's very impressive for an infectious disease
Managed.
specialist.
I'm a super dodger.
Sure. All right. Finally, do you have any tips if somebody needs to go out and buy some masks? There was a lot of confusion for a while. Is the gator really a mask? Does the fabric make a difference? If you order it from a website, is that legit?
Yeah. So, right when everybody was wearing masks, when everybody had to wear a mask, surgical masks were good enough because they prevent the person who's wearing the mask from really infecting those around them. So if everybody's wearing a mask, everybody's protecting everybody else. When not everybody's wearing a mask, a surgical mask is not enough to really protect the person who's wearing it. If you need protection, if you have an immunodeficiency, if you are at high risk and you want to protect yourself, you really have to go up to wearing either a KF94, a KN95, or an N95. Now, N95s should be fit to the person. And they're harder to wear for a long time. Those are the ones that are strapped behind the head and they're very tight to the face. The KF94 and the KN95 give you almost as good a protection. Those straps go behind the ears. It doesn't have to be fit to the person. Generally, I wear a KF94 when I'm out and about because that's what I find the most wearable for the shape of my face and whatnot. But a lot of people wear KN95s, and every now and again I see somebody in an N95. And when I go into a COVID room, and usually when I do something like flying, I'm wearing an actual N95.
All right. Very helpful. Dr. Matthew Sims, Director of Infectious Disease Research at Corewell Health. Thanks so much for your time today.
Happy to.